Have you been doing core strengthening exercises such as planks, crunches, leg raises, or deadlifts, or have been advised to do such exercises for your low back pain? Hi, I'm Chloe.
And I'm Michael.
We are seeing quite a number of patients trying such exercises to resolve their low back pain, but instead end up getting more pain.
Yes, although core control is very important for our back as well as the rest of the body, not knowing what core control really is or doing exercise in the wrong way can actually aggravate the condition.
Today, we'll be sharing more about what core control actually means and how to train your core in an effective way. There are three main components to a core control. The first being a diaphragm forming the roof of the abdominal cavity. The second are the pelvic floor muscles forming the bottom. And lastly, the transverse abdominis muscles surrounding the entire trunk. When these three muscles are working together, they can pressurize the abdominal content, causing the entire trunk to be very tough, providing support to the back.
To help you understand what we really mean, we have a can. Can you see? This is a can that's full of tea and it's sealed currently. And assuming this is similar to our human body abdomen region. The diaphragm forms the top of the can, the pelvic floor is at the bottom, as well as the surrounding, which is same as our abdomen. Now when the can is full of tea and is sealed, actually I can't crush it. I can move it anyway, it cannot crush it. But what happens if the top, which is the diaphragm, gets opened up? What will happen? Well, you can see it can no longer be so rigid, and if I squeeze it, yes, and water can be spilled out easily. So the harder we squeeze it, the more water coming out. Therefore, this is not what core control is really about. Let's demonstrate how to train the core control in the right way. As we said just now, core control we have three components, namely the diaphragm on the top, the pelvic floor at the bottom, as well as abdominal wall muscles over here. Most people who has back pain tend to have certain muscles working too much, but not at the core region. For example, if the legs are working too much, and if I palpate you, Chloe, do you feel a bit tender here? Yeah, a bit like ticklish, right? This is when the legs are usually actually a bit tense. If I shake her, you notice that her pelvis rock and roll together with the leg and the other leg as well. This is because habitually she links these three portions together, separating that from the waist level and above. And that's wrong, because our core control is supposed to keep our trunk in one unit instead of be separated. Instead, what she can do is to first of all relax her legs. Can we do that? Okay. After you relax your leg, can I ask you to draw attention to the buttock itself? Between the left and right buttock, and you squeeze them to the center so that you can feel a back of the body printed back to the bed. When you're doing that, it's important for you not to tense your leg muscles, so which means you're doing a slow squeeze. Is that okay with you? Can you do a little bit rock and roll like that? Perfect. This way, you should be able to feel the buttocks coming to the center, and this is how you activate the pelvic floor at the bottom. Now let's draw attention to the diaphragm on the top. The diaphragm is over here, which primarily involved in deep breathing. Can you do the deep breathing for me? Thank you. Very good. When we do abdomen breathing, diaphragm goes push down when you're breathing in. But most people do not know that a diaphragm has a second job, which is just like purging, which is a consistent contraction. So Chloe, I'm pressing your tummy down. Would you mind using the purging action to push my fingers up? And this time you can do it consistently. Would you be able to talk to me like this? Perfect. So breathing is not part of this purging action. This is when we use the diaphragm consistently. Great. The third one is abdomen wall itself. Abdomen wall usually works on when you're breathing out. And so Chloe, would you mind take a deep breath in and blow the air out continuously. The more you blow, the more you can feel the abdomen wall squeezing nicely. That's right, let go. Okay, so with all these three components being activated, now you can combine them together. What happens, Chloe, if you can purge down as if you're going to toilet, and if you close the buttock at the same time as if you're not going to toilet, and abdominal wall naturally tenses up. These three muscles combined together forms a very tough state. And this is the important part, because when you are doing this, the whole trunk is united in one piece. And can you try to make sure the trunk does not move while the leg is moving? Okay, give it a try. This is great. As long as you are able to hold this in one piece without movement, you are having the proper core control. It is important to know, doesn't mean that these three muscles must work as hard as they can. Doesn't need to be so. You just need to unite them together simultaneously. It's good enough. So after you already understood how to activate the core control in a basic way, let's progress it to make the muscle work harder. In this situation, Chloe is in a 4-point kneeling position. Chloe, can you make sure the shoulders can point up towards your ears and point down towards the buttocks? Can you repeat up and down like this? Okay, if you can do that, can you now keep it down here away from the ear so your neck feels long? This action is done so that she can engage her muscles in the armpit region. This is linked together with your core region. Okay, I would like you to give a try. You have 4 points of support. Now Chloe, can you try to remove one of your hand? And this forms 3 points support. If you feel that the arm is taking most of the additional load, it'll be wrong. Instead, I'm hoping your tummy is the one that's taking the additional load. If you use the arm to take the additional load, the elbow tends to be in the locking position. That is wrong. Try to make sure the elbow stays soft. Okay, and drop down. Can you repeat left and right in the right way? Yes, very good. This is how you want to train your tummy in this upper limb movement. Okay, now can you progress it to the lower limb part? What happened is this will maintain the same shape. I would like you to use the tummy to draw one of your leg up from the bed. It's important for you to make sure you do not shift the pelvis from side to side, but rather try to do a vertical lift. When you do that, you can feel the tummy is working hard, and so is the shoulder muscles way over here. This is when you toughen up your internal control. Now let me invite Chloe to demonstrate some of the lifting techniques. Common mistakes of lifting include keeping the legs straight and bend forward. Even though when she does this, she can brace her tummy, that will still be not enough to keep the back in a healthy way. In fact, the stress is too high. So this is one of the common mistakes for people. Second one is when she does lifting, but this time she keeps her back very arched and she uses her leg power to push herself up like this. By doing this, keeping the back vertical region, it's going to cause the overload of the back muscles and overload at the knee joint area. That is also not good for our health. The correct way is something in between. Can I have Chloe to point your buttock to the back in a horizontal manner, and you engage the core region so that you can relax the arms as well and breathe naturally. What I want you to do is to push the buttock forward and have your tummy holding backwards. When you have these two combinations, you should be able to lift up the weight very easily.
If you are an active individual who plays racket sport and you are experiencing tension around your shoulder region or your lower back region, you may not be bracing your core effectively. I will now get Michael to first demonstrate an incorrect way of using such technique. As you can see, Michael is overarching his back, giving a lot of strain over his lower back region as well as generating a lot of force around his upper limb region, and that is not healthy for the shoulder joint as well as the lower back. If he can effectively brace his core and allow twisting and torsional movement of the trunk along with the shoulder limb movements, this will allow him to generate a much more powerful force and reducing strain along the shoulder region and the back region.
Are you experiencing lower back pain or doing exercises but not getting a result? I would like to hear your comments and questions down the comments below.
As always, for such useful contents, give us a like, follow, and get notified on Facebook as well as our YouTube and Instagram. And I'll see you on the next episode.